Many patients come to see me for cataract surgery, and the discussion naturally progresses to what type of lens I would recommend for them to have in their eye after removal of the cataract. It's an important discussion as there are three principal lens types, and each type has advantages and disadvantages. So I hope to cover some of these in the next few minutes. The first question I ask patients is, do you mind wearing glasses? Many patients have worn glasses all their life. They like wearing glasses, it's part of their identity, and they want to or certainly don't mind wearing glasses after cataract surgery. In that case, I recommend the patient has a monofocal lens, usually set for distance, which means they'll not need to wear glasses for distance, but will need to wear glasses for intermediate work or for reading after surgery. Patients will generally achieve very good results of that with high quality of vision and be very happy. If a patient wants to reduce their dependence on glasses, it's a good idea for me to talk to them about the second and third type of lens options out there. The second type is an EDOF lens, or an extended depth of focus lens. These lenses give patients good vision in the distance and in the intermediate range, but patients will then need to wear glasses for reading, particularly small print. The nice thing about these lenses is they generally don't give patients much glare and halos when driving at night. And the third type of lens, the multifocal lens, this is the type that can free a patient from glasses for distance, intermediate, and for reading. And all of that is wonderful because a patient can then ditch the glasses and generally not need glasses for most tasks. However, those lenses do come with the downside of glare and halos when driving at night. So it's important that a patient understands that although multifocal lenses have the upside of reducing dependence on glasses, their downside is some glare and halos, particularly when driving at night. So if multifocal lenses are so good, who can't have a multifocal lens? Well, actually, there are certain patients who shouldn't have a multifocal lens. Some patients with certain types of ocular disease, such as corneal disease, or macular disease, such as macular degeneration, these patients are best avoided when it comes to multifocal lenses, or best advised against multifocal lenses. If a patient has advanced glaucoma or severe dry eye, or has had retinal surgery for macular, such as for macular hole repair, it's best to avoid a multifocal lens. There are certain patient factors where we should avoid multifocal lenses. And this is patients, for example, who have a very high visual demand, such as patients who are pilots or photographers, or patients who really want perfect vision in the distance, intermediate, and near. It's best to avoid multifocal lenses for these types of patients. If a patient's had previous eye trauma and a multifocal lens is at risk of slippage, it's best to avoid a multifocal lens. Or if they've got a condition called pseudo-exfoliation, where the supporting structure for that lens is not very sound, it's best to avoid a multifocal lens as they rely so well on good centration. If a patient's had previous refractive surgery such as LASIK or PRK or RK, it's probably best to avoid multifocal lenses. And finally, patients with neurological disease such as stroke or MS or Parkinson, it's best to avoid multifocal lenses. So those are the three types of lenses: monofocal, EDOF, and multifocal lenses. Now, to really understand these lenses, it's best to talk about toric lenses, because all these lenses are available in toric versions. And toric lenses are generally used when a patient has significant corneal astigmatism. So if a patient has significant corneal astigmatism, I will then recommend a toric lens, and that toric lens will help correct that corneal astigmatism And in general, they really don't have much of a downside. They don't have much side effects, other than a very small risk of rotation, which may need a further operation to rotate them back into position, although thankfully that's very rare. So all types of lenses, such as monofocal, EDOF, or multifocal lenses, come in a toric version. For monofocal, it's useful to use a toric version to reduce the need for glasses for distance after surgery, hence why I would then recommend a toric in a patient with a monofocal. I recommend a toric for a patient who's having an EDOF lens or a multifocal, but not because I'm worried about their need for glasses, but because actually to get the most out of those lenses, it's important to really reduce corneal astigmatism, to reduce the need for glasses in the intermediate range and in the near range for those lenses as well. So I hope these past few minutes have helped make some sense of the lens types available when you're having cataract surgery and helped you with your decision making when deciding what type of lens to have. Good luck.